Good evening and welcome to another brand new episode of iMed on Channel I. And today also the focus is on what has engulfed the entire world. It does not matter who you are, where you are from and what you do, COVID-19 has engulfed the entire world and it has affected every facet of society. It doesn't matter what kind of precautions you take, you always have to conform to the health and safety guidelines. To talk about, especially with a big focus on the vaccination process that has been started in Sri Lanka. With us once again we have Dr. Sunil Ratnapriya, the Secretary of the Association of Private Hospitals and Nursing Homes in Sri Lanka. Welcome to the show, Doctor.
Thank you.
Doctor, let's get the discussion started on the vaccination process. Now that we've seen that the government has started administering the vaccines to the public in Sri Lanka, what are the latest developments associated with the vaccination? How did this entire process of vaccination begin?
It is really, it is a program basically organized by the government. So, they will announce from time to time that which sectors they are planning to vaccinate. So, that is why they started with the state sector hospital, the healthcare staff, and then they moved into private sector healthcare staff. And even in the private healthcare sector, I think in the government sector, most of the categories were covered. But in the private sector, with the limited stocks, they gave priority to some sectors, some job categories, like medical specialists, medical officers, nurses, paramedical staff, the housekeeping staff, catering staff, like that, which they thought would be more at risk. And so it is, they only will from time to time announce the category that they are planning to vaccinate and the arrangement they are making.
Right, Doctor. So the public has this question in their mind, will I ever be eligible to get the vaccine, when I can get the vaccine? So we see that, they started with the government workers, the healthline workers, the frontline workers in different facets of society, which is very important that we give the vaccine to them first because they are more at risk. So moving forward, when they open it up to the public, who will be treated first? On what basis would the vaccination happen?
Yeah, I'm sure they have mentioned things like that. Initially, it will be prioritized among the citizens above 65. It has been mentioned, but it may not be so. But no, even now, say those traders who attended the Manning market, the vegetable sector, now they were vaccinated. Then the prison officials were, prison jailer guards and such categories were vaccinated. So, government will plan, health ministry will plan and announce these sectors we plan to prioritize.
Right, Doctor. And Doctor, are there any guidelines as to who will not be eligible based on health reasons or age reasons? What are the parameters that are in play in getting to know the eligibility?
Yeah. The government has, health ministry has issued a detailed circular giving instructions, and according to that they have mentioned, I have it with me here, they have mentioned those categories who may not be eligible for this. One is that pregnant and those who are on lactation. So the possibility of pregnancy has to be considered by everybody. Then people above, young people below 18 has also not been recommended. So because trials have not been conducted in such categories. Then those who have immediate or delayed severe anaphylactic reactions, severe reactions to vaccines, those are also not being considered. And then allergic reactions to components of the vaccine, severe anaphylactic reactions, such categories have not been recommended the vaccine. But those with comorbidities, they are quite okay. They can receive the vaccines. Diabetes, hypertension, all that crowd.
I think that's very valuable information that you're passing on to our viewers, doctor, because it's important, even if you are above the age of 18 and if you think you need to get vaccinated, you think that will protect you from COVID-19, it's important to note that if you have severe allergic reactions, you better take care of yourself and you should inform the authorities.
Inform the authorities.
And then the authorities, I believe, doctor...
They will decide. They will take precautions and consider.
Yes, like doctor said, they will assess and see whether you can receive the vaccine. And doctor, let's talk a bit about the vaccination process as well. If I'm not mistaken, there are 2 doses that you need to take. What is the time duration? How does it work, doctor?
Time duration also, initially they were talking about 12 weeks. Then there is again a reconsideration, because these are being sort of rediscussed and reevaluated. So currently second dose, they have not given a specific time period. But there is a second dose, but the time period is still not firmly announced.
Right, doctor, because these are drugs that were introduced recently as well, so the trials are going on. Right, doctor. In talking about the vaccine, now there's a fear among the public to get this vaccine as well, thinking, and they've been hearing from the people who are vaccinated that it has a strong effect on your body, that you get aches, that you get fever. So when you talk to people, the public, they're scared to get this vaccination. So what are the after effects, what are the consequences that you go through when you're vaccinated?
Yeah. Well, those are not things to be frightened of, but certainly you have to be prepared for such things, because it depends on person to person also. These are the common things that they have mentioned, but you can get. You can get on the site you got the injection, you can get pain, warmth, redness, itching, and so on and so forth. Then basically you can feel very tired, fatigue-like, and then feverish, mild fever, even chills. I have seen some people getting chills, joint pains, and flu-like symptoms. So many of them have taken Panadol. They have, while taking the vaccine, they have taken a Panadol, and then like 6 hourly or 8 hourly you can continue Panadol. Some have developed kind of vomiting, so tablets, something like domperidone tablets you can take. So you can reduce your symptoms, but at least 2 or 3 days you will have to rest at home.
Right, but there is nothing serious.
No, nothing serious. Yeah, I mean, no severe reactions. Uncommon, they have mentioned as uncommon being dizzy, decreased appetite, pain, abdominal pain, and like enlargement of lymph nodes and things like that. But no severe reactions have been mentioned. No severe complications have been mentioned. So they can go without much fear.
Right, and as doctor said, it is nothing to be scared of. There shouldn't be any fear associated with getting vaccinated, because we see even in the society, people are generally scared of getting vaccinated. So that general fear is there. Yes, doctor. Yeah. Injection. The whole idea of injection is something that induces fear in the mind of Sri Lankans, I think.
Yeah.
But that is like doctor said, and you can take his testimony, because he has gone through the vaccination, and as you can see, he's quite okay. Like he said, the symptoms or the conditions, the after effects of the vaccine can last for around 1 day or 2 days, right, doctor?
About 2 days.
About 2 days, but more importantly, that you need to get vaccinated in order to protect yourself from COVID-19. So that's where you draw the line, where you decide this is something that you should definitely get yourself exposed to. And
injection itself is not painful. It's just 0.5 ml. So it's much less than like a tetanus toxoid pain that you get in tetanus toxoid injection. So injection itself is not painful at all. It is after that only you see the effects.
Right. Doctor, as of this moment, the vaccination is only administered by the government in government hospitals?
It is by the government hospitals, but what was given to the private sector was administered by the private hospitals themselves. When it is given to us, it was our staff who gave the vaccine.
Right, doctor. So right now we can see that it's been administered
at private hospitals as well.
Right, doctor. Now, when it comes to the private hospitals, doctor, we spoke about in the earlier episode how it's important that if you have the symptoms to go to a hospital, get yourself tested. And also, apart from COVID-19, even when people have different kinds of other symptoms that can probably cause other diseases, people are still, we can see that they're still scared to go to these institutions, to private hospitals, maybe government hospitals, private. They're just scared of the fact of going into a hospital. How can we change this? What are the precautions? What are the specific measures taken by the private sector healthcare facilities?
Yeah, we have taken several measures at the entrance as well as inside the hospital and before the procedures. So all those patients or visitors who come are being screened at the entrance. There are about, probably in a big hospital, 2 or 3 entrance points. So there are security staff and the nursing staff to receive you, and the hand washing facilities are there. Then foot bath is also there. So you wash your hands properly, and then you come. Then your temperature will be checked to see whether it is less than 98 degrees Fahrenheit or 37 degrees. Then you should be wearing masks and things like that. Then you are given a screening form, hospital details form. So you need to fill that, give your appropriate, give your details, telephone number, address, and so on. Some of course consider this as a nuisance, but it is for the good, your own good as well as for the society, because you may have to be contacted again, you may have to be traced back later, not at that time. And then inside the hospital, all staff, they are wearing the personal protective equipment, distance will be maintained, and so on and so forth. Then if you are going through surgery, the PCR testing will be done, and they will ensure that you are not suffering from COVID. Similarly, the hospital staff which are involved in surgery, including surgeons, they go through regular PCR testing.
Right, doctor. We talk about the development of technology and the technological advancement, especially in a post-COVID era. Let's talk about how the private sector healthcare has incorporated these technological advancements into treating patients, given that that we have to avoid physical contact as much as possible.
Yeah, this is one area that we really embarked on. From the time that physical contact was discouraged, we went into digital platforms. Consultations were organized online. Telemedicine was used. Then the homebound care, the visiting services for diagnostic tests, collection of blood, and all those were strengthened, so that staff with precautions will visit the patient and discourage the patient from coming here. Then for communication, online media were used very much in conducting training programs, educational programs, communications between hospitals. Also digital communications were used. So that way technology was very useful, and also not in large scale, but in a lower scale, something appropriate for our country. A lot of engineering measures were developed in order to reach patients when the patients come, for them to for them to be issued drugs and so on, other reports and things like that, to prepare areas like that away from hospital, things like that. So that way also technology was used in a lower scale but very appropriately.
Yes, doctor. And before COVID, we had to, after getting our tests done, we had to go back to the hospital to collect our reports. Now everything can be downloaded online as well.
Correct.
So all these facilities are available to you through private healthcare as well as government healthcare facilities. So there's no reason to fear or be afraid of going towards these healthcare facilities that are readily available for you. As doctor mentioned, they've taken all the necessary precautions to make sure that you and everyone around yourself is going to be very safe. And doctor, since we talk about the technological advancements, let's talk a bit about this contactless PCR testing system as well that's available in few private healthcare hospitals.
Yes. The facilities are available for you to come into the hospital in your own vehicle and get yourself tested without walking into the facility. This is particularly for patients or persons who don't have symptoms but wishes to get a test done, probably for their occupation purposes, like pilots who are going repeatedly, they have to undergo PCR. Then they would also prefer not to get into the facility, and because they don't want to expose themselves. And again, from the staff point of view also, they also have less contact with the patient. So this kind of facilities have been organized. But we have to emphasize in such a situation that the patient has to be in contact with the hospital. And if you do it in the morning, the test, at least by afternoon you can get the results. And then according to the results, we will be informing the epidemiology unit of the Ministry of Health, the PHI, and then you have to be aware that you have to follow the ensure the follow-up procedures after that.
So doctor, I believe there's constant communication between the government healthcare sector, the ministry, and these private institutions as well. In a case where a positive case is reported, that communication is there, and that's quite vital as well, I believe.
Yeah, the government private sector communication is continuously there, because one thing, there is an organization called Private Health Services Regulatory Council, which is chaired by the Director General himself, Dr. Asela Gunawardena. The secretary of that committee is also the Director Private Health. So of course, last few months when the the health ministry was very busy, we couldn't meet regularly. But we are very happy that this body is now again activated, and we have got a new Director Private Health also, and we had a meeting recently with the Director Health. So even the vaccination program was coordinated jointly by the Association of Private Hospitals and the Private Health Services Regulatory Council. So it was both our parties that collected all the details from the private hospitals throughout the country, then transmitted this information to the epidemiology unit so that they could plan the vaccine distribution program. So while this permanent mechanism is there, constantly the patients who become PCR positive are being informed by the private hospitals. We are duty bound to inform the epidemiology unit and the PHIs so that they can take the follow-up action.
Doctor, we earlier spoke about the fear that people have of visiting the hospitals. I think as a consequence of that, we can see the footfall in private hospitals has reduced. This has greatly affected these private hospitals. So what is the Association of Private Hospitals doing about that? What are the measures that the association has taken in order to resolve this issue?
Yeah, in the beginning we found that a drastic drop in the footfall. People were really scared to come to hospitals. I think it dropped about 75% initial drop, and this particularly affected the medium and small hospitals, which are spread throughout the island in various cities. So, but gradually we were able to, as I mentioned earlier, keep them informed about the developments, send them the new protocols issued by the Ministry of Health, educate them, and then gradually they got their act around, started protectionary measures, personal protective equipment and other training facilities to educate their staff, and gradually they were able to pick up. And last year during the period of July, we organized a major physical meeting where they were took all the precautions, and in a large auditorium we organized a seminar for them to send their representatives, and then they were spoken to by experts in various fields, including government organizations, the economic problems, the other administrative problems they have, then the medical problems and so on. So we had a very successful seminar. So, so this gave them lot of strength for them to, and also we facilitated for them the loan facilities and so on through the banks, and gradually for them the private sector industry to pick up. And another important thing that we did was to, because initially though our hospitals have been pioneers in the PCR technology, initially the government, we were not allowed to do the PCR for dengue testing, the COVID tests. We were doing for dengue and all, we were the most popular centers for dengue PCR. So gradually we managed to convince the health ministry, negotiate with them, lobby with them, and we managed to, it was the association that managed to get the PCR testing facilities for some of the private sector laboratories. So I think that strengthened the private sector. And then again another step that we took was to convince the government that we could provide care for the patients, so that there will be less burden on the government, because those who can afford and our customers who have been coming to us will be able to spend money and then be in a facility where they can be looked after, even at least at intermediate level. And then lastly we managed to get the vaccine for the private sector staff.
With that, we've come to the conclusion of today's episode of iMed. We would like to once again thank Dr. Sunil Ratnapriya for enlightening everyone on the vaccination process, the eligibility criteria for vaccination, and most importantly, how important it is to get yourself vaccinated. And even if you're vaccinated, why it's so important to conform to the health ministry guidelines that have been set by the government, and why this is a battle that we all need to fight together. The private healthcare sector is there, the public healthcare sector is there, but no matter what efforts and measures that they have put in place, it's up to us as responsible citizens to stick to these guidelines and make sure that everyone around us stays safe and happy. So with that, thank you very much, Doctor, once again for joining with us. So that's all we have for you in terms of iMed for tonight. Good night and stay safe.